Success on the journey of porn addiction recovery. I'm Dr. Trish Leigh. Welcome back to another episode of the podcast, which I have been dying to record. But unfortunately, if you have not seen my YouTube videos, unfortunately, I have acquired toxic mold poisoning. And it makes for a lot of hills and valleys. And I'm going to share some of that with you because I usually speak from my heart on these things. And these are the things that are on my heart and mind right now. Because as I experience the ups and downs of the beginning of mold toxicity recovery, I have you in my mind at all times. So I wanted to share some of the congruencies of what I'm experiencing and how it can help you stay the course. And especially if you're at the beginning of a porn addiction recovery, I want you to know, I know how difficult it is. I know there's so much to figure out and there's so much back and forth and up and down. And that's what I've been experiencing. And it's so frustrating. And I know you want to give up. I'm here to tell you, start the journey today. Time is a wasting. You only get one life. Don't waste it in the screen, running away from intimacy and just running into dopamine hits for pleasure so that you can avoid life. Life's way too short to avoid it. It's there for the taking. You just got to get into it. You got to get out of the screen and into your real life, and I know how difficult it is. So the journey starts. The journey of 1,000 miles starts with a single step. So if you are inclined, and this is not a sales pitch, but I want you to know, on my website, drtrishleigh.com, is the 90-day Complete Essential Guide program. Get into it. And I say this with love because if you're out there floating around, watching porn all the time, and being in a downward spiral, you can access that program and begin your upward spiral today without anybody knowing about it. It's affordable, it's accessible, and it's anonymous. If you want our help, we're here to help you. But if you want to get in and start trying to do it yourself, it is there for you. And the reason I say that is because on this toxic mold journey of mine, I have been sick for a really long time, and I knew I had weird stuff going on. And for a while, I never went to any doctors because I'm like, okay, this must be stress. Let me reduce some appointments. Let me work out more. Let me clean up my diet even more. I kept getting worse. And I'm like, okay, it's not those factors. And so I sat in this thing for a really long time, years. And I didn't even know. I literally was breathing in toxins every single day to the point where I am incredibly sick. You're visually taking in toxins. You are physically taking in toxins when you consume pornography and you couple it with masturbation. It is producing a brain pattern that is knocking out functioning in the frontal lobe, and it's desensitizing the reward center in your brain. And that has so many negative effects that I'm here to tell you, it is damaging your brain. It's creating anxiety if you struggle with it. It's creating depression. It's creating overwhelm. It's creating porn-induced ADHD. It is damaging your relationships. If you have strain and stress in your primary relationship with your honey, it's likely due to or exacerbated by porn, even if your partner doesn't know you watch porn, because it changes you. It makes you less excited about your partner, and it makes you find more faults with your partner. It gives you an avoidant attachment style, which creates a whole host of problems. It can strain your relationships with your children, with your friends. It gives you so much shame. And I know how difficult it is to come out of it. There's physical, cognitive, and mental health ramifications to consuming porn, and they're all supported by science, and it damages your brain. I've now looked at probably at least 1,000 brains of people who consume pornography, and it gets their brain stuck in couch mode. That's why your motivation is out the door. That's why your focus is decreased. Okay, that's not what we're talking about in this podcast, but that is the the public service announcement for today. So let me move on to the journey and what it's like. So in the 90-day program, essentially what the journey is focused on unwiring the brain pattern that you've been using likely for your whole life, because people find porn when they're young. And so likely it's been impacting your brain since childhood or adolescence. We have to unwire that brain pattern because it got wired in when you were young, and we know brains are more neuroplastic when you're young. But we also know brains are neuroplastic across the lifetime. So we're going to unwire that pattern by putting up some strong fences and keeping you out of the screen, and by exploring the past, any traumas, dysfunctions, patterns, anything you're holding on to that would lock your brain up in a neuro-rigid pattern. You don't want a locked-in couch mode brain. That doesn't give you the life that you want. So we have to unwire that brain pattern and move forward in rewiring your brain towards the optimal, healthy, rock out your best life mode. How do we do that? Number one, we do it through brain training. That's why I encourage everybody to get the Muse headband. The link is below. You can do it by yourself. Then, if you ever want help from me and my team, we're here for you. We can help you with the headband. But get started by yourself. It's a great entry point into brain training. You have to train your brain, and you literally can train your brain to perform better using that headband. I have been doubling down on using my Muse, and I use our professional provider neurofeedback platform. Also, I call it our Brain Shift program. Every day I've been doing it. Actually, I've been doing neurofeedback for an hour each day in different pockets. And my doctor has said about this whole mold toxin junk I'm dealing with, my doctor commented that for the state of affairs in my system, I should have a lot of cognitive issues and a lot of mental health issues. But my brain's rock solid because I've done neurofeedback the whole time, and I doubled down when I found out I was really sick with this stuff. And my brain, I can see it's in problem solving mode. You got to give a girl a break. I'm solving problems, but it is not stuck in that extra fast, high beta anxiety mode, and it has not lost power, and it has not slowed down. Thank goodness, which is why I'm here making videos for you, because you're on my mind all the time and here recording the podcast. Okay, so that's the number one way, using technology, using electroencephalogram, that we can rewire your brain. But you also do it by taking new actions that create new thought systems, that give you new feelings, that help you literally become a new person. And so when you take new actions and you have new thoughts and you feel new ways, you're no longer operating on that old crusty, dusty programming from your youth or from your younger years that sent you into the screen. Now you have new improved, right? You had a software update, a new improved way of operating that doesn't need porn anymore. And when you update the operating system through brain training, through those cognitive behavioral therapy techniques that I'm talking about, by mindfulness, by positive psychology, these are all measured and shown to help people in recovery. So when you do that, and that's all in the 90-day program, when you do those things, you're literally rewiring your brain on a daily basis, minute by minute. And this is how I've been thinking about it for myself these days. It's like, and I've always thought of it this way, my scales of justice analogy, if you haven't heard me say this, is that, you know, your scales of justice should be pretty balanced. And then things are good in the system. And if something tips the scales in one direction, we have to tip the scales back to make them even again. So if stress comes on, or if you have doubled down on accident and watching more porn, then you need to put other things, healthy things, on the other scale to move you in the right direction. This is how I've been thinking about it in my own life these days. Every day I try to do as many things to help me get better. And I try not to do any of the things that are going to make me worse. And this is very difficult because my doctor has told me, actually this is the last test I have to do, is a cortisol test across the entire day. We have to look at how my cortisol is spiking. Cortisol is the hormone for stress. So I've talked about, mini fight or flight lots of times here, and I live a life of kind of mini fight or flight. Even while I'm recording this podcast, I have gotten two phone calls that I need to call back that are likely, not emergent, but urgent in my family. And that happens to me all day, every day. So I'm constantly getting these little cortisol spikes. So if I get cortisol spikes in the day, I need to do something to offset that so I can get well. And honestly, I've tried to take out as many of those stress-inducing things in my life. And it's weird because I've had to make really big decisions. We had to move. That's a huge decision. I have 2 dogs. My friend took one of my dogs, and likely her mom is going to take poor Luna Lee long term, because I'm going to be out of my house long term and I can't be managing all these animals on top of all the children. And it's like crazy to have to make that decision, but it had to be made because I want to get well. That's the way to rewire your brain. It's by figuring out what's important to you and keeping that in and keeping it as the healthy scales, and then reducing the stress and reducing the things that push you into the screen. And those are the choices I'm making on a daily basis. So I'm starving and I have to take all the time to make one of my green smoothies when I'd rather just eat corn chips and salsa verde. I gotta tell you, I ate corn chips and salsa verde yesterday because I was absolutely starving. And I'm like, it takes like 15 minutes to make the green smoothies. And I'm like, I may pay for this, but that's what I'm talking about. Those are choices. And I didn't pay for it because thank goodness. I only ate a couple of them while I was making the smoothies, but those are the scales of justice. So I made the choice knowing that doesn't add to my health and wellness. I doubt it's going to take away from it, but it's definitely not a step in the right direction. I've been trying to take as many steps in the right direction and avoid the potholes. And then lastly in the journey is hardwiring your brain by setting goals for yourself that are important for you and tapping into the feelings that those goals would give you. Feelings are what we care about in this world. And even in your porn habit, you're probably tapping into some feeling that you want to get. And I'm going to put a bow on this before we wrap up so you have some takeaways. But feeling, think about that. And when you create goals for yourself, creating goals for yourself, especially if you have a family, is very difficult. Like when I found out I was sick, I think I've shared this with you, but my husband thought it wasn't as big of a deal as it was. And I realized I'm sick. I got to get out of here. And I said to him, dude, I got to go. I want you to come with me, but if you can't leave this house, I got to go. I don't know what to tell you. And this has happened a few times in our relationship lately because he's in a different situation as I am. The reason is, not that you care about mold toxicity, but apparently there's 26% of the population that cannot process mycotoxins, the toxins from mold. So I've been very sick for a while because I'm one of those people, and the rest of my family has not gotten sick. They have no symptoms, but I've had them tested and they have the mycotoxins in their body. When my husband saw his test, guess what that man did? Moved his action into my new townhome. And obviously I'd have it no other way. My whole family's with me now, but he wasn't that motivated until he was personally impacted. So what that did to me was it made me decide what's more important, what he thinks or me being well, because I knew every time I went in that house, I got sick. And so I had to tell him, I gotta go. I came over here and I rented the townhouse myself. And I'm still the only one on the lease. I had to do it for myself. So freaked me out, yeah, but very empowering too. And you show the universe, I'm doing what I need to do to take care of me. And I did it kindly. I wasn't mad. I just said, I don't know if you're in a position to do this with me yet, but we're in different spots right now. I have to go do this for myself. And I'm going. And I did. And you might have to make those decisions in your journey, and especially when you create your goals, because your goals might not be the same as your partner's. They don't have to be. They shouldn't be. You have to have some shared life goals, or it's difficult to live a life with a partner, but not all your goals have to be shared. And we're trying to decide if we should move back into the house because I like this simplification minimalism. My husband, not so much. He wants to roll on back to our house. So we'll have to see where the compromise lands there. But I have to create my goals for myself and he creates his for himself. Now, the cool thing is once your brain is out of the screen, you will be able to have an interdependent relationship. We know that if you consume pornography with any level of compulsive behavior, that it creates avoidance in you. So it's more difficult for you to create goals with your partner just because you're in an avoidant attachment style. And you have to come out of the screen before any of that fog can clear. Okay, so let's talk about putting a bow on this journey. This is a journey, and we know that 90 days is the bar that we set for the journey. I just wanted to clarify that for a minute because in my brain shift program, 4 months is basically the shortest we can help a person because it takes 1 month to shift your brain using neurofeedback, and then it takes 3 months, 90 days to stabilize the system. It's shift and stabilize. Theoretically, you can shift in 1 second. Not theoretically, in actuality. Some people shift. They commit, they start training their brain, and it takes 90 days. And that is a best case scenario, which does not happen for all people. But if you commit 100% and you take your scales of justice and you keep putting all the healthy things on and you take all the negative things off and you balance them, you will be able to move through the 90-day program in 90 days and come out the other side smelling like roses and having a solid foundation built for yourself. So it is a journey. I wish my deal wasn't a journey. I'm told it's probably going to take a year for me to get all this junk out of my body and get back to being healthy. But does that mean I go, ugh, a year I don't feel like doing it? I totally don't feel like doing it, but I have to. I have no choice. And if you want to get well, you have to. You have no choice. And you can make that decision just like I did. You can move out of your house. You can tell your partner you got to go do the things that you need to do. Got to go into the woods by yourself and you'll come back a better version. I'm doing it. You can do it. But it's a journey. And then when you're on the journey, the beginning is so difficult when you have to create new things and take things out of your life that have been there forever, like porn, like checking people out, like fantasy, like the interactional style that you've had. But when you start doing that, you start feeling better. And those peaks of betterness keep you moving forward, but you need the tools and strategies. And again, going back to my own journey, I've been doing this for a long time without any help. I've looked for doctors for the last 6 months. I finally found someone who I'm confident. I'm hopefully confident. I don't know, it's an oxymoron. It's not an oxymoron, but definitely I'm confident. I'm going to say it. I'm confident that my doctor's going to help me. And when I signed up for care, the office sent me a 10-page wellness plan telling me what to do for right now. And I'm only in the evaluation process. They're telling me all the things to do to evaluate my situation so they can help me. And I feel like somebody knows what's going on with me and they can figure it out so that I can get better fast. That's what the 90-day program does for you. That's what my neurofeedback coaching program does. If you want personal help, we look at everything you've got going on and we help you figure out all the changes that need to be made so that you can move forward and ride off into the sunset. But it is a journey, but the difficult part is at the beginning. And then once you start seeing it pay off, man, is it amazing. And you will be so glad. I get emails every day, thankfully, from beautiful people who send me an email saying, thank God I found your program because I have been caught up in porn for so long. My relationships are suffering, my work's suffering, I'm miserable. I found your program and I've been clean, I've been sober, I've been honest, I've been in integrity, and I'm moving towards my best life. And that's what I want for you, but you need the right techniques, tools, strategies, and support, just like I needed to invest my time, energy, and money into all the right stuff for me to get better. I want that for you. We have the right stuff for you if you are ready to commit. So let's do this thing. Time's a wasting. Okay, so I'm going to wrap it up from here, but let's put a bow on it before we do. So the bow is, there's 3 phases to this thing: unwire, rewire, and hardwire. And it really is broken down into past, unwiring the past, your brain pattern and the programming that's keeping you down, rewiring your brain and your life in the present, and setting goals and intentions and action steps towards them into the future. And it's a mind, body, and true self program. So I call it a 3x3 brain rewire program. It is past, present, future, mind, body, self, unwire, rewire, hardwire. And I would love for you to take advantage of it. Okay, I'm so glad to be back on the podcast. Hopefully I can stay well enough to be consistent, and you can look forward to another podcast next week. And in the interim, control your brain or it'll control you.